You've made a lot of sacrifices over the past many months. You helped keep people safe. You helped save lives. Everything we did, small and big, in following public health orders, in making sure that ourselves and our loved ones and frontline workers were safe, made a difference. So thank you. On this 8th and final day of Hanukkah, and with only 1 week to go until Christmas, there are more than 75,000 active COVID-19 cases across the country. Deaths per capita are continuing to rise in many G7 countries, including Canada. Countries around the world continue to feel the pain of the second wave. We need to take this very seriously as numbers continue to head in the wrong direction. Our fight against this virus is not over, even as we're preparing to say goodbye and good riddance to 2020. It may be the holiday season, but we have to be more careful than ever. On Monday, vaccinations started for the most vulnerable and our frontline workers. Canada has secured agreements for up to 417,000 doses of COVID-19 vaccines ahead of schedule. This includes over 200,000 early doses of the Pfizer vaccine scheduled for next week and 168,000 doses of the Moderna vaccine before the end of December, pending Health Canada approval. I want to assure you again that any vaccine approved in Canada will be both safe and effective, and that health experts are making those decisions independently. In January, we'll be getting 125,000 doses of the Pfizer vaccine per week for a total of about 500,000 doses for the month. With the guaranteed millions of doses coming in 2021, every Canadian who wants a vaccine will get one, no matter where they live. This is the largest immunization campaign in our country's history, and I know that we have the right plan and the expertise that we need. Getting a vaccine in a week or in a month won't do you any good if you catch COVID-19 today. That's why we need to keep working to halt the spread of COVID-19. So please, continue to follow public health guidelines. Avoid gatherings, practice social distancing, use the COVID Alert app, do the right thing for the most vulnerables, and think of being careful as a gift you can directly give your fellow Canadians, especially frontline workers who continue to step up every single day to keep us safe, to keep Canadians safe. Nous faisons beaucoup d'efforts.
We are making a lot of efforts to make sure that Canadians have access to safe and effective vaccines throughout the country. At the same time, we are also making sure that we procure and develop treatments to fight COVID-19, as well as other viral infections. In that regard, today I'm announcing an investment of close to $9 billion through the National Research Centre in Canada to support the development of these treatments. This investment will go to 4 companies for treatments against COVID-19, 2 in Montreal and 2 in Vancouver. It is important to continue developing solutions right here in Canada to fight against COVID-19 and to prepare for any other eventualities. It is through working with researchers and scientists and businesses that we will attain our objectives.
Time to cook good food and have a few extra pieces of dessert because, well, why not? But for far too many others, the reality is very different, especially during this pandemic. More than a third of Canadians who rely on food banks are children. That's unacceptable. In a country like Canada, no child should go hungry. In October, our government announced another $100 million under the Emergency Food Security Fund, doubling our investment from the spring. This morning, Minister Bibeau outlined the details of where that additional funding will go, including $30 million for food security in First Nations, Métis, and Inuit communities. With these funds, food banks, local food organizations, and Indigenous groups will be able to purchase and safely distribute food to help vulnerable people and communities. I want to say a special thank you to all the volunteers and workers at food organizations who've stepped up to help their fellow Canadians. I met many of you virtually in October, and I remember you sharing how you had to adapt really quickly when the pandemic hit. Thank you for your work, your time, your generosity, and for your commitment to answering the call for others in need. Je sais qu'on aurait tous espéré.
I know we would have all liked the situation to be different for the holidays. The year has already been difficult, and once again, we are asking for extra efforts on your part. But this is not time to let down our guard. There is hope. We know that vaccines are arriving. We were not sure that we will have a vaccine against COVID-19 when we talked about it 6 months ago. Our scientists and researchers have done incredible work here and throughout the world. And now we know that there is an end to the pandemic, and it's coming. But we are not yet there. We have millions of doses reserved for Canadians. Everyone will be able to get a vaccine in 2021 in Canada. But before we get there, together, we need to spend a difficult winter. We must continue doing what we've been doing for months. Be careful, avoid gatherings, follow public health guidelines, download and use the COVID Alert app, avoid gatherings. Christmas will not be the same this year, but it's still going to be an opportunity for us to be with our close ones, physically or virtually, and to think about how we were able to go through this pandemic as individuals and societies, be there for one and each and every one, and to grieve the thousands of Canadians we have lost, but to step up efforts to have an even better Christmas in 2021, far better than the one we are going to have this year. But to do that, we must hang in there. We may offer our vigilance as a gift to our public health workers working in the front lines to protect us, even during the holidays, to save lives. We all have a duty to protect them, and we have the capacity to do so. Let's continue doing what we have to do, and we shall get through this.
Our government has done everything we can to protect you and your family. We've sent millions of pieces of PPE to the provinces and territories. We've created special programs for families and workers who needed it. We've supported small businesses so that they could stay open and hold on. We've presented historic measures to rebuild a more resilient economy that works for everyone. Now, I know that this won't be the kind of holiday season we might have hoped for, but that doesn't mean we can't feel hopeful about what comes next. This past year has had its challenges, but we faced them together. When this new virus started spreading, few people thought we'd have an approved and safe vaccine so quickly. So thank you to our scientists, to researchers, and to experts around the world who stepped up and worked incredibly hard. You've all done incredible things this year, and it's important that we keep supporting you in the work you do, and that we keep listening and trusting you in your expertise and your work to keep us all safe. The vaccination campaign has started. Millions of doses are already secured and will be coming in the coming months. We planned thoroughly. We're relying on advice from the best experts, and we're working with the provinces and territories to roll them out. Canada has the most vaccines secured per capita and the most diverse portfolio of vaccine options in the world. We're also doing our part to help developing countries get access to more tests, treatments, and vaccines so we can fight this pandemic everywhere. There are reasons to be hopeful for 2021. Just like through this spring, summer, and fall, we will continue to be there for you. We will have your back every step of the way, We will do, as a government, whatever it takes for as long as it takes to keep you safe and supported. We're coming into the final miles of this crisis, and we can't give up now. So stay home, stay safe, and we will get through this together. Joyeux Noël tout le monde. Merry Christmas, Merry holidays, and mostly Happy New Year.
Thank you, Prime Minister. We'll now turn the phone for questions from media. Just a reminder of one question, one follow-up. Operator.
Thank you. Merci. Première question, Raymond Fillon, TVA. À vous.
Question. Thank you, Mr. Prime Minister. I would like to come back to the CERB. People have been asked to repay the money they received by the 31st of December. Following interviews, you asked CRA to be indulgent. But what should those people do? What should they do exactly? Answer. Thank you very much, Raymond. We know that already millions of payments were made to the CRA, people who received the CERB without being entitled to receive it. So Canadians understand that it's important to be fair and responsible. But I also know, and I've heard Canadians say that they are concerned by that information that they received by the Canada Revenue Agency. What I'm telling them is, do not worry. You don't need to make those payments before the end of the year. It was just for your information. We understand that of the hundreds of thousands of people who received those letters, there are people in very different situations. We will be looking into those situations in the upcoming months to make sure that we are there to help the most vulnerable. Rest reassured. We want to make sure that we're not giving money to people who needed it to take it back during Christmas. We are there to help most vulnerable people, and that's the promise we made as a government, and we shall continue keeping that promise. Follow up. So people will not be taxed, because it's written in white and black that if you don't repay by the 31st of December, you will be taxed. So are you confirming? Answer. I can confirm that people who made honest mistakes, maybe people who receive some of those payments, don't have to worry about taxes. We will work with everyone. The pandemic is still here. People are still anxious and worried. It is a Christmas. It's going to be a Christmas unlike any other. I don't want people to get worried. I've made a promise that we shall help the people who need help, and we shall continue doing so.
People need to know that we were serious when we said we would be there for people. We didn't deliver support to millions of Canadians who needed it just to claw it back at Christmas. Already we've seen over 1 million repayments of people who got the CERB payments unjustly or extra CERB payments, and that's because Canadians are fair and fair-minded and responsible. But every step of the way, we've promised to be there for vulnerable people, so I don't want this to be an extra stressor on a Christmas that is already not like others. So be reassured, any good faith mistakes will not be penalized, will not be pursued. We're going to work with people over the coming weeks and months to ensure that people get the support they need. I think all Canadians want to be focused on the things that matter the most this Christmas, your health, the health of your loved ones, and the opportunity to recollect this past year and look towards the next year with renewed optimism. These letters should not be a source of anxiety for anyone.
Thank you. Next question, please, operator.
Thank you. Merci. Next question, Dylan Robertson, Winnipeg Free Press. Line open.
Good morning, Prime Minister. Your Quebec Lieutenant Pablo Rodriguez told Le Devoir that you can't increase health transfers because the structural expense would jeopardize Canada's credit rating. You've never mentioned the credit rating issue in this context before. In fact, you said you will increase health transfers. So is Mr. Rodriguez making this up?
Obviously, we're proud of Canada's very strong credit rating because it contributes to us going into this pandemic with one of the strongest fiscal balance sheets of any of the G7 countries, and we continue to have it. But as I've said, our focus is on being there for Canadians as long as they need it, whatever it takes during this pandemic, and that's what we're doing, which is why we have flowed billions of dollars in supports directly to Canadians, to workers, to families, to small businesses, why we've flowed money to provinces to support the most vulnerable, to help with their health systems, why we've delivered on PPE, on rapid tests and testing kits, and now on vaccines that we're paying for. We have demonstrated every step of the way that we're doing what it takes because we know that that's not just the right thing to do, that's the best way to ensure that our economy comes roaring back for the long term. I have said we will sit down and work with the provinces on expanding health transfers because we know that long term there is a need for that. But those decisions are to be taken once we see the other side of this pandemic and we have a better idea of what the future looks like. Our focus is on being there to support Canadians, and that's what we're going to continue to do.
And a follow-up, Dylan?
Okay, so you didn't actually answer the question on the accuracy of that statement, but I just want to ask about Rivera and the pension plan. Rivera has given false information to Winnipeg health officials numerous times about its nursing homes, like how many staff it had during outbreaks. Rivera is owned by the public sector pension plan, so why are you not leveraging those shares to get the company to increase its staffing in care homes?
Right now, our focus is on supporting seniors, vulnerable Canadians right across the country with whatever is necessary. That is why we have worked closely with the provinces on extra help. We put forward $1 billion more in the fall economic statement to help with infection control and prevention and other measures in long-term care homes. We continue to work with the Red Cross, and we sent in the Army through this past month, and we are focused on being there to support vulnerable Canadians and seniors during this crisis. I have no doubt that as this crisis in its current exigencies draws to an end, there will be many reflections about how we deliver long-term care to seniors across this country in a way that respects their dignity, their safety, and ensures the best quality of care right across the country. The federal government is happy to be part of that conversation, and part of those reflections that I know provinces are going to have are around differing outcomes in different styles of care homes. I think those are important conversations to have, but right now our focus is on doing everything we can to support the vulnerable Canadians in those care homes.
Thank you. Next question, please, operator.
Thank you. Merci. Next question, Tonda McCharles, Toronto Star, line open.
Good morning, Prime Minister. Speaking of what you were just talking about, reflections on lessons learned and whatnot. Whoops. Sorry. You spoke, when you spoke to us after you met with the premiers, you said that you thought it was necessary to take lessons on public health from what was happening in this pandemic, and that we had to learn lessons just as we did through SARS. And yet I don't hear you ever suggesting sort of what that looks like. I know there's an in-house lessons learned exercise going on at Health Canada, but can you speak more specifically to how you would like to see that lessons learned exercise unfold? Is it a federal inquiry? Do you think each province has to undertake their own? What do you see?
I think every day during this unprecedented pandemic, we have been learning from what we did the previous days, the previous weeks, and that is ongoing, so we can make sure that every given week, every given month, we're giving the very best support in the best ways to Canadians. And that means listening to our experts. It means looking at the outcomes of what we've been able to do. It means learning from what other jurisdictions are doing. And certainly, this has been a constant exercise in examining what has been done, what could be done better, and bringing those in as quickly as possible. Of course, as we get through this pandemic, there are going to be many, many larger lessons to learn, to set down, and to set in place so that future governments faced with similar situations, although we certainly hope not, will be better equipped with what we've learned through this pandemic. I think that is simply understood, that we will have to be very serious about making sure we learn all these lessons that were tragically extremely hard learned through this pandemic. But we haven't yet decided or determined what that looks like. We're still very much focused on getting through this second wave right now.
And the other day, when in one of those year-end interviews, you told an interviewer that you in contemplating, when the next election might happen, possibly in 2021, you said while your government won't choose is not necessarily in the driver's seat on that, but you are, that an election, first you have to get through the pandemic. You said we have to get through the pandemic first. So I'd like to understand, what does that look like to you? What do you determine, what will determine when we're through the pandemic? Is it 50% of Canadians vaccinated? Is it a certain level of control of infection? Can you speak to that? When do you deem us to be sufficiently through the pandemic?
I think you lay out exactly sort of the range of reflections and uncertainties that we know for 2021. We know that we are going to be vaccinating millions of Canadians and vaccinating every Canadian who wants it, and that will get us significantly through this pandemic. We know that experts still have to evaluate carefully which threshold of vaccination will allow us to start releasing some of the restrictions in various places across the country. Will they be in certain sectors, or will they be in certain regions? There are many things we don't know. What we do know, however, is we're still very much in the middle of this second wave, and the decisions that we take now as Canadians to keep ourselves safe are going to make a difference for the coming months. As to political considerations and what decisions happen around elections, well, we will see, because that's not our focus right now. Our focus is on supporting Canadians now and in the months to come, and getting them vaccinated as we get through this pandemic.
And Glenn McGregor, CTV News. Prime Minister, the United States is expected to vaccinate about 10 times as many people per capita as we are by the end of the year. And this schedule of Pfizer deliveries you just mentioned looks like the rate of deliveries is going to be constant. It's the same rate we're receiving them in December as we'll be getting in January. My question is, what are you going to do to close that gap, given that the strategy you've talked about, the broad variety of candidates, is kind of a gamble? We don't know they're going to be approved. We don't know when they're going to be delivered. But we do know at the current rate of the one approved vaccine, the Americans are going to vaccinate a lot higher percentage of their population before we do. What do you tell Canadians about that gap?
Indeed, we have secured, as you point out, one of the best ranges of vaccine portfolios of any country in the world, and we've secured more potential doses per Canadian than anywhere else. So we know that while it is important, and it is great news that we're starting to vaccinate now in December ahead of schedule, it is once we get a significant proportion of the population vaccinated that we will start to be able to look at loosening restrictions. The Americans have a healthcare system that will have challenges and will have successes. We have our own process. We're focused on our own process to make sure that as many Canadians as possible get vaccinated as quickly as possible with vaccines that are safe and effective and approved by Health Canada. We are, of course, watching approvals elsewhere around the world, but the decisions made as to what is right for Canadians and what is safe for Canadians will be done by the Canadian experts who are putting our safety first with a gold standard of approach that is the envy of the world. We will continue to focus every step of the way on delivering safe, effective vaccines for as many Canadians as possible, as soon as possible.
En français, s'il vous plaît, Monsieur Trudeau.
Nous allons continuer de nous concentrer sur l'importance de livrer des vaccins sécures,
safe and effective vaccines to the greatest number of Canadians as quickly as possible.
le meilleur portfolio
Indeed, we do have the best portfolio of potential vaccines of all countries, and we also have the greatest potential doses per person than other countries. But we know that it will take many months before we get to levels where we can relax some restrictions. But until then, we must listen to our scientists. But at every stage, we are doing all we can to make sure that Canadians are protected when it comes to their health and safety. Radio Canada question. I understand that you are saying that you are not going to abandon Canadians in need. We do have freelance workers who did not have a lot of money and will have to repay the CERB. But at the same time, businesses took advantage of CERB to be able to make lots of profits and pay dividends to their members. But these ones are not going to be repaying the CERB. Do you think that this is unfair? Answer. We are facing an unprecedented crisis and pandemic, and as a government, we needed to take a decision. Do we analyze every application in March and April to make sure that we were giving money only to those who needed it most, including, though not forgetting the situation that we did not know what the coming weeks and months were going to look like? Or did we have to take a decision to quickly help people so that they could be able to get through the pandemic? Yes, indeed, the government made a choice. We decided to help people, and we decided that later on we will find out how equitable that was and find out if anyone took advantage of the system and require those who wanted to engage in fraud to pay back. But the choice we made to quickly help the most people possible was the right decision for Canada. Already, we have seen that even with all the tragedies we saw, the tragedy hit us less hard than other countries. And when we look at the jobs that have returned, we are now at 80% of jobs that were lost that have returned because of COVID. And the United States, it's only at about 60%. So we made the right decision. Now, we shall find out how we can continue helping the vulnerable people. And if people did not act right, for example, businesses, in the way that they used those grants, we shall look into that. But the basic decision we made was to be there for Canadians, and that's the decision we made at the very beginning. We wanted to make sure that everything will be fair. So as far as helping Canadians is concerned, we did right. Follow-up question. Let's be clear. So companies that abused the CERB and who made profits from the wage subsidy will have to pay it back in the coming months. Answer. We shall look into the rules to find out if the rules were respected, to find out if everything was equitable as intended. But the choice we made was primarily to help Canadians get through the pandemic and later on find out what was properly used or what could have been an opportunity for businesses to take advantage of the pandemic.
I think people know we made a choice as a government, not a choice that every government around the world did, not a choice that every political party might have made, but we made a choice to help Canadians rapidly at the very start of this pandemic, flowing supports to families, to workers almost immediately, and supports to small businesses and businesses of all sizes rapidly afterwards. And that has worked. That has worked to keep food on the table, to prevent Canadians from plunging deep into debt. It has also worked to hold on for many small businesses and main streets across the country that will be able to, instead of having to rebuild from scratch when this pandemic is done, will be able to simply reopen. That's going to help us come roaring back. And we're already seeing the impact of that choice we made to help Canadians have positive echoes. People have seen better health outcomes than many of our peer countries around the world in terms of fighting COVID-19. People are also seeing 80% of the jobs that were lost because of COVID-19 already back in our economy, whereas the United States are just around 55 or 60% of those jobs come back. So we've done well because that was the right decision to take. But that choice to get help out quickly to everyone meant that we understood that after the fact, we would have to look at things and see if it was done fairly, if people took advantage of this in improper ways. Like I said, good faith mistakes will not be punished, but there are people who committed fraud and companies who perhaps profited in ways that is not right, and those are things that we will look at. But again, the focus on this pandemic is getting through it, and I think that's what Canadians expected.
Hi, Prime Minister. Tom Perry, CBC. I'm just wondering if you've heard anything from Pfizer about whether they can ramp up deliveries as the year goes on, if you've heard from other companies about how quickly they can deliver, just to get an idea of how quickly vaccines might be coming in. And also, if I could just put a second part on this. A while back, you said that if Canadians buckled down, they might be able to save Christmas. So what do you think went wrong?
I think, first of all, we continue to work with all the vaccine producers to try and ensure as many doses as possible for Canadians as quickly as possible. We're pleased to have clarity and predictability right to the end of January in terms of deliveries of Pfizer. But as we've said, with potential Moderna vaccines arriving before the end of December, pending Health Canada approval, and the Pfizer vaccines already coming in and reaching Canadians, we are very confident about our ability to vaccinate 3 million Canadians at the very least by the end of the first months of 2021. But there's much more to do, and we will continue to work with all the vaccine companies. In regards to Christmas, at Thanksgiving, we saw that cases were rising, and we continue to be in this second wave. But I know that Canadians have been doing the right kinds of things across the country. And yes, people are tired and people are frustrated and cases are still creeping up in some places and going in the wrong direction overall. But I've seen it in the conversations I've had, in reports from across the country, how Canadians get it, that we just need to hold on for a few more months as vaccines are starting to arrive, and we'll get through this. Canadians are pretty good at making it through long, tough winters, and this is going to be a longer and tougher one than we're even used to. But I know, because I've seen people there for each other, people wanting to do the right thing even though it's hard, that we're going to be able to keep cases under control because Canadians stay focused on the things that matter.
Prime Minister Michael Couture from Global National. Despite what you just said in Canadians doing the right thing, in Ontario today we're seeing over 2,000 cases again, and we're going into a period where people are likely going to want to try and bend the rules a little bit. Because of the holidays, they want to get together with people. How frustrating has it been for you that no matter what you say out here and no matter what Dr. Tam says, that the numbers continue to go up somehow?
I think the vast majority of Canadians are being incredibly thoughtful about what they're doing, about how they're keeping themselves, their loved ones, their parents and grandparents, frontline workers safe. But we've seen the challenges of this coronavirus hit extremely hard in communities across the country and indeed in countries around the world. That's why we need to continue to remain vigilant and attentive. But the uncertainty we've had over the coming months, when we didn't even know whether or not there would be a safe and effective vaccine, has now been lifted to a large degree. We know that there will be an end to this COVID crisis. We know that vaccines provide an end, and it's coming. And as tough as this winter is, the spring will be better and the summer may well be much better. But to get there, we have to keep hanging on. To get there, we have to stay disciplined and be there for each other. Because I know as much as many of us want to see our loved ones this Christmas that we won't be able to see except through a TV or computer screen, we also want to be able to see them and give them big hugs next Christmas. And our capacity to have them here with us next Christmas depends on all of us thinking about doing our part this Christmas and in the coming months of this winter. Je pense que les gens
Answer repeated in French. I believe that people have to continue doing their part. We see people wearing masks, maintaining physical distancing, following advice, even if it's difficult. Canadians are good at living through difficult winters. Our country is known for its winter. We can see that in the way we live. This winter will be another difficult one, and we shall get through it. And we know that summer is coming, and summer will be better. Spring may even be much better. But at this time, we need to think. Yes, we want to see our loved ones and our friends this Christmas. We can only see them through computer screens in most cases. But that is so that we will be able to see them next year, next Christmas. We will be able to get together and celebrate without lots of tragedies, without losses of parents and grandparents and vulnerable people. All we know how to do as Canadians, and we shall get through this.
Canadian Press. As you bid good riddance to 2020, what is your message to the Chinese government on how they ought to be treating Michael Kovrig and Michael Spavor? And could you please clarify earlier remarks you made this week about whether or not you are actually optimistic they will be getting out anytime soon, or if there's any tangible sign of that?
This will be the third Christmas that Michael Kovrig and Michael Spavor spend in arbitrary detention in China. It is incredibly frustrating to me that the Chinese government continues to not understand that Canada is a country that respects the rule of law and will continue to. That we are a country that rejects coercive diplomacy and arbitrary detention, and that China's approach in the way it's been conducting itself is not improving its relations with any country around the world, and indeed is harming its own interests. We will continue to pursue every avenue to bring the two Michaels home as soon as possible. And I remain hopeful to get good news an hour from now, a day from now, a week from now, a month from now. We continue to work and be optimistic that we're going to be able to bring them home. But we will not put in danger other Canadians, and we will not flinch in our defense of the rule of law and of the values that Canadians hold dear. We will continue to stand up for our interests and our citizens every step of the way. Merci beaucoup tout le monde. Thank you, guys.
Thank you very much, everyone.
All right, that is the Prime Minister of Canada on this Friday before the Christmas break anyway, giving an update to Canadians. He did say Merry Christmas and Happy New Year at the beginning, so leading me to believe that he might be taking a little break too in the days ahead. Catherine Cullen and David Cochran both joining me now to help with our coverage. I guess there was a little bit of news there on the vaccine front. David, I'll start with you on that in terms of the schedule for the Pfizer doses coming in the new year.
Yeah, starting in January, they're expecting about 125,000 a week for a total of 500,000 doses that month. So I don't know if that's the old estimates of how many doses are in a vial or the new estimates of how many doses are in a vial. But when you stack that on top of the doses we are anticipating from Pfizer already this month and Moderna you've got enough for about 450,000 people could be vaccinated by the end of January. Right. Very small percentage of the Canadian population, but moving in that direction. And as we've seen, these delivery timelines can change, right? They can be moved up, they can be accelerated, but as we're seeing in countries like the United States, they could be delayed, right? We've had some governors, particularly Jay Inslee, the governor of Washington, saying that they've been told that they're not going to get 40% of the vaccines they were anticipating before the end of the year because of various delivery dates, and it'll be spread out over shipments throughout the first quarter. So the numbers that have been promised in a lot of cases that are being banked on in a lot of jurisdictions, those are not solid. As our old boss Rob Russo used to say, there are no facts in the future. These are anticipated projected delivery timelines, much like these are for Canada. But the Prime Minister facing the question there that is a slower pace than some of the bigger countries are expecting, and only a small percentage of the Canadian population will be vaccinated in the first quarter.
Yeah, a slower pace, but again, that's a good quote from our old boss, because until things are actually done, it's hard to make comparisons. He did say, though, that he was very confident that at very least, 3 million Canadians will be vaccinated in the first few months of the new year. So he clearly feels that they're on the right track. I'll come back to you in just a second, David, because I just want everyone to weigh in sort of on his comments to Canadians as he leaves us, potentially until the new year. We'll see. Catherine, let's get you to weigh in on CERB, because there were a lot of people trying to get further clarity after your reporting yesterday from the Prime Minister. What did you make of what he said there?
I thought that was an interesting parallel, Rosemary, in his broader message to Canadians and what he was saying about CERB specifically, right? He was given a lot of opportunities, talking about Canadians more broadly in the holiday season to sort of take a tougher stand, say, like, look at where we are, shouldn't we be concerned? And he seemed to keep returning to this message of hope. And I thought that was very much reflected in his response on CERB. Like, the takeaway certainly that he wants, I think, Canadians affected by this situation to have is, do not worry right now. We know this is a difficult holiday for everybody. We are going to be compassionate. He said at one point, good faith mistakes will not be penalized, will not be pursued. Now, I understood that to mean over the holiday season, but it still does, I think, leave people affected, obviously, with very many questions, like pursued to what end? As he pointed out, 1 million people have already paid back some amount of CERB. In fact, there were, just to put that into context for people, 8.9 million applicants for CERB. Now, some of them found out that they had double dipped, in a manner of speaking, by accident, right? They had applied for EI and for this benefit. They got both. They paid the money back right away. So and we do know that that's where a significant chunk of these cases come from. But if some people have already realized they weren't entitled to the money and they paid back, what does the government then do about other people who say, well, you really left me with the impression I was entitled to this money, and I'm in a very difficult situation right now. It's obviously something the government is seized with. If you are personally affected by it, I'm still not sure what you take away from today that allows you to know where this is going, but it was clear the Prime Minister was trying to communicate, I guess, more optimism around the file.
Yeah, and just for people not to be stressed out over the holidays, if that's possible. I don't know if you've got a big bill coming your way, how you do that. But David, you wanted in there?
Yeah, I don't know how reassuring that answer really is, right? Like, don't worry about it for the next couple of weeks, right? But back home, old Christmas Day, things go back to normal. Is your CERB bill due then? I mean, it is a question that requires an answer that is certain. Because if you go back to it seems like 5 years ago now, but when CERB and everything was started, was apply. If you're unsure, apply. Honest mistakes won't be punished. That's what the politicians were saying. CRA is sending these letters out now that is causing a lot of anxiety and causing a lot of uncertainty. And then you stack that up next to the stories, and the Prime Minister was asked about this today, of businesses that got the emergency wage subsidy and then increased their dividends to shareholders or are sitting on pots of money and piled profits. Well, what's going to happen there? As a political problem, going after low-income people, like this $5,000 thing that Catherine's been reporting about, that gross versus net, when the legislation actually says total income, if you don't waive that or move beyond that or solve that while allowing big companies to give dividends to shareholders, you're going to create a nightmare for yourself. And I just don't see how reassuring this actually is. So, like, have a great Christmas, but you could have a really rough New Year if we do decide to collect on this. It's something they need some specific answers around and and specific guardrails, whether it's means tested or based on income level or based on individual circumstances. But they've got to get some clarity on this, because it's going to stress a lot of people out and maybe ruin them financially in the new year.
They could certainly write off some of those people if they did what they said they would do, which is, if you are not using the wage subsidy for wages, we're coming to get that money. And we now have increasing examples of companies that weren't using that money for wage subsidy, and they should have probably have it clawed back, because that's what the federal government has indicated. Catherine, sorry.
And I would say just that this is an argument. I can almost hear Jagmeet Singh screaming at his television if he's watching right now. This is an argument the NDP has been making at the top of its lungs, right? Why are these large corporations benefiting when this is some of the stories we're hearing? These are from very poor people. One of the first people that I interviewed in covering some of this was I'll say a young woman, younger than me, I suppose, but somebody who has a disability, and her disability benefits allow her to make $500 a month. So she did that by making jewelry. The arts and crafts shows closed down. She applies for CERB to subsidize some of that income, because she's not somebody who has a lot of money. And now she's facing an $8,000 bill. I think, if nothing else, the NDP has talked about the morality of this, the political optics, whatever you want to call it. Seeing the government threatening to take away, or the CRA, however you want to define it, take away money from people like that. I think it's a really unfortunate situation. Again, the Prime Minister is trying to offer some reassurance, as he did with you yesterday, Rosemary. I did ask one person who had received one of these letters, a man by the name of Jack Neufeld, for a piece on The National last night, what he thought of the Prime Minister's comments to you. He has already taken out a loan to pay back some $20,000. He said, that sounds like political talk to me, and it doesn't make me worry any less. So I think the Prime Minister tried to offer more reassurance today. We'll see where that gets Canadians.
They're clearly going to have to offer some parameters around what a good faith mistake is and who falls into that category. Before I let you both go, and there is a public health briefing coming up that we'll also carry live, although not with us, I just wanted to get you both to weigh in on the Prime Minister's message today to Canadians as we go into this holiday season. Schools are going to let out. It's happening on the same day as Ontario is apparently contemplating a similar lockdown as the one that will happen in Quebec, which would start on Boxing Day, potentially for 3 weeks, potentially for the south of Ontario. Nothing's been announced or decided yet, but that seems to be on the table. David, what did you make of what the PM had to say?
It's a message we've heard so many times, right? At every holiday. I go back to Throne Speech Day when he did his national address and said, Thanksgiving is a write-off, but if we buckle down, we can have a Christmas. And Tom Perry asked him about that, and we're not really planning on getting a Christmas. Now, people may do it. People have been ignoring public health orders and going to social gatherings and doing these things, and I just don't know what it will take for people to abide by this. Look, some of this spread is happening because of the economic circumstances people are in. They have to go to work. They don't have sick leave. Their workplace protections are maybe not where they should be, and that is a larger question than the deliberate choice to socialize or travel or go shopping in a big crowded place. I don't know what more they can do on a messaging front to get people to change their behavior. To me, the most compelling messaging is coming from people like Dr. Michael Warner, who was on News Network yesterday talking about dealing with people dying in his ICU and how they have to say goodbye to their loved ones over an iPad, which is horrifying. And I think we need to do this for the healthcare workers. As the son of a nurse, I sort of understand that, because I remember how exhausted I'd see my mother be when she'd come home from working overnights and things like that. I can only imagine what it is like for health professionals during a pandemic. But if you haven't gotten the message by now, I don't know if you're ever going to get the message. And if you look at the daily counts, it was a few weeks back when David Williams, the Chief Medical Officer in Ontario, said that if we follow these new restrictions, we can be in the green zone, to use the Ontario color coding system, by Christmas. Daily cases have tripled in Ontario since he said that. So I don't know if messaging works anymore. I don't know if people see vaccines coming and have just decided to let it go. But that is light at the end of the tunnel, but it is a long, dark tunnel right now, and it's more than 100 deaths a day in this country and rising.
And I think a lot of it, not just vaccines on the horizon, Catherine, but just an overall fatigue. Yeah. So if you're dealing with people who are fatigued, who want to see their family, maybe the only thing to do is what they have had to do in Alberta and in Manitoba, which is just shut it all down to try and prevent people from taking the options of doing things at all.
Yeah, again, I was really struck by the fact that he kept going towards a hopeful message. I wondered, it made me reflect a little bit about sort of the challenges of the Christmas season, that it's already a difficult time for a lot of people, the compounding of this. I was just really struck at the end. He kept talking about spring, summer, this will get better, this will get better. But in contrast, or maybe in addition to what David was just saying, I mean, there are other approaches, right? I think of Ottawa Public Health tweeted out a thread at the beginning of the month, sex, drugs, and Santa Claus, that got a lot of attention. But it was about harm reduction was the idea, right? That if you tell people not to be promiscuous, or if you tell them not to use drugs because those things can be bad for their health, they're not going to listen to an abstinence message. So Ottawa Public Health saying, listen, we don't want you to gather. It is not the right thing to do. But understanding that some people are going to do it anyway, there are safer ways that you can do this, be it through the use of masks, being outdoors, paying special mind to the people in your families who are the most vulnerable. And if you're gathering, should they really be there with you? Again, with the overall caveat, don't do it. It is not what we want to see people doing. That really, I don't think that was, it was certainly baked into the message from the Prime Minister today, but he really, I thought, seemed very focused on the light at the end of the tunnel and asking people to curtail their behaviors, I guess, as best they can. It's going to be tough on a number of levels. Dave is very right to point to the hospital situation, the situations in the provinces, the mental health challenges. Our colleague Hannah Thibodeau has done some excellent reporting around that. It is a difficult time. There's no denying that.
The data right now, Rosie, just points to January being horrific. And there's no other way to look at it. I mean, hospitalizations, intensive care bed use, and deaths are all lagging indicators. And we're looking at 2,400, 2,200 cases just here in Ontario, 15, 16 in Alberta. The really severe manifestation of symptoms and then the fatalities are 2 to 3 to 4 weeks after those positive diagnoses. And if Christmas becomes a super spreader event, January is just going to be maybe the grimmest year of this at a time when vaccine arrivals will start ramping up in Canada.
Well, that's the thing. If the light is at the end of the tunnel, hold on till you get there, because now is not the time to let go. That's sort of the Prime Minister's message. Thank you, both of you, Catherine Cullen, David Cochrane. David Cochrane, guest hosting Power and Politics today at 5 Eastern. Thank you. Appreciate it very much. That is the Prime Minister speaking to Canadians on this Friday, potentially for the last time before the holidays, but we will see what the rest of 2020 brings. It's been a difficult year, but he did confirm today that 125,000 doses of the Pfizer vaccine will arrive each week going into January. So more vaccines on the way. There is a briefing with public health officials coming up, but first we'll take a short break. I'll hand things over to John Northcott, and I'll see you soon.
This is CBC News Network. I'm John Northcott. Thanks for joining us on this Friday, December 18th. We're waiting to take you live to Ottawa. Top public health officials will provide an update on the latest COVID-19 measures and figures. Canada gearing up to distribute a second vaccine from Moderna, pending its approval. Doses are designated for the territories as well as remote and Indigenous communities. We'll bring you the live remarks when they get underway. And as the role of the coronavirus vaccines picks up in this country, a global initiative today promised to distribute 2 billion doses to the world's poorest countries in the next year. Canada playing a big part in all of that. Laura McQuillan is here with more on today's announcement from the COVAX Alliance. Laura, walk us through the details.
Okay, John. So COVAX, this group that includes the World Health Organization, organizations that focus on immunizing children in poorer countries and also on global epidemic preparedness, have joined forces. They've reached agreements with drug manufacturers, and today they're announcing that they've reached agreements with AstraZeneca and Johnson & Johnson for doses of their promising vaccine candidates. So these deals, an advance purchase agreement with AstraZeneca and Oxford for their vaccine, would be 170 million doses. With Johnson & Johnson, it's 500 million under a memorandum of understanding. That, on top of existing deals that COVAX has done with manufacturers, takes it to about 2 billion doses to be distributed next year. That is, if all of these vaccines come online and get regulatory approval. I'll walk you through some of the details of how they're planning to roll this out internationally, because they say they can get a lot out the door next year. In terms of distribution, they say in the first half of 2021, they hope to have health and social care workers in 190 countries getting their first doses. By the end of next year, there should be enough doses out there to protect up to 20% of the populations of those countries. So that means the rest of the populations will have to wait a while. You see there 2022 additional doses of these vaccines would become available. But when we're talking about 190 of the world's poorest countries, you need far more than 2 billion doses. And I have reached out to the partners in this COVAX Alliance today to find out how many doses they need, when they're going to arrive. They haven't come back to me as yet, John, but it does look like there is going to be some wait for these countries compared to what a country like Canada is planning, where it hopes to have the whole population vaccinated by the end of next year.
Okay, Laura, let's talk about how this program is expected to work and what Canada's role will be in all of this.
So this alliance has been working with manufacturers, but also with philanthropists, with governments, to figure out these deals to source the vaccine, but also to roll it out in countries that might need a helping hand with logistics, with planning and things like that. Canada is one of the countries that is chipping in funding. Earlier this week, it announced $75 million towards this COVAX program, and $5 million of that was earmarked for reallocating doses of vaccines that countries wouldn't otherwise need. Canada being one of the countries that has agreements in place to buy up big for vaccines. We're talking 414 million doses for a population of 38 million. So enough doses to vaccinate every Canadian many times over. The Prime Minister has said that those doses will be shared, those surplus doses, with countries that need them. And that earned a shout out just a short time ago from the head of the World Health Organization. When he was speaking about this deal, he suddenly brought up Canada, and here's what he said.
I would like to thank Canada and Prime Minister Trudeau for committing to share surplus doses of COVID-19 vaccines. These unprecedented agreements mean that all 190 countries and economies participating in COVAX will be able to access vaccines to protect vulnerable groups in their populations during the first half of next year.
A lot of details, however, with Canada's surplus yet to be worked out, whether that would be waiting until every Canadian is vaccinated before any of those doses are shared, which would make it some time off. Either way, it does seem that this plan will take quite a while to get everyone in those 190 countries vaccinated, but now we know there are deals in place to get at least 2 billion doses out the door next year, John.
Thanks for this, Laura. Breaking news for you now. CBC News has learned that Premier Doug Ford's government is considering a lockdown across southern Ontario from Boxing Day until January the 11th. This as COVID-19 cases in the province reach record highs. Megan Fitzpatrick joins us now on this story. Welcome back, Megan. What do you know?
Pretty much what you just said, John. That's about what we're reporting right now, that this is a proposal that has been put to Doug Ford and his cabinet. They will discuss it this afternoon. This is not confirmed. This is not what the government has announced. But what we know is that they are considering this kind of widespread lockdown that would apply to Southern Ontario between December 26th and January 11th. Sources telling CBC News it could be somewhat like what Quebec plans to impose after the holidays. Quebec is going in the direction of imposing a mandatory work from home order, for example, shifting schools to online learning for at least a week after the Christmas holiday break, those kinds of measures. The source is telling CBC News that precise restrictions have not been decided upon or the duration of a further lockdown. So all of these things still being considered, John, but we know Doug Ford will be meeting with his cabinet later this afternoon. He does not have a media availability today, but we are expecting to see him on camera as he heads into a meeting at 1 o'clock, just a few minutes from now, with Ontario hospital leaders and his Chief Medical Officer, Dr. David Williams, the Chief Medical Officer of Health for the province, and Health Minister Christine Elliott. We know this meeting comes after the Ontario Hospital Association has called for further lockdown measures and for stricter measures within the lockdown phase in terms of the government's sort of color-coded system that it uses. The Hospital Association extremely concerned about the rising rate of hospitalization and people in intensive care and the effect that that is having on the wider healthcare system. And they are very concerned about what might happen over the holiday period if people choose to ignore the public health advice, which, as we know, is to stick to your own household and not to get together with others. So yesterday, Doug Ford said everything is on the table in terms of what next steps might include. Toronto and Peel region, for example, have been under lockdown for almost the 28-day period. That expires on Monday, those measures that were imposed, and then the government said they would review the situation and see where things are at and if that lockdown would be extended. So, and then later on, York Region and Windsor have been put into the lockdown phase as well. It is normally on Fridays, John, when the government announces any changes in the color-coded system and what public health units are in what color. And so we're watching for any news this afternoon and, of course, any remarks from the Premier himself. But for now, to recap what we understand based on what sources are telling CBC News, Doug Ford's government considering a lockdown from December 26th to January 11th that would apply to most of Southern Ontario. Northern Ontario would be exempt. What exactly that would look like, John, though, that's what Doug Ford will be discussing with his cabinet this afternoon.
All righty. Thanks for that breaking news, Megan. Megan Fitzpatrick in Toronto. Now, we're heading live to Ottawa. Public health officials giving an update on COVID-19. Let's listen in.
Pfizer-BioNTech doses per week starting in January for a total of 500,000 in January alone. We are on track to receive the balance of the Pfizer 4 million doses in Q1 as previously mentioned. This inoculation effort has been a Team Canada approach like no other. Santé Canada a tenu son engagement d'évaluer rigoureusement
on its commitment to thoroughly and efficiently assess vaccine candidates to ensure that safe and effective vaccines are available to Canadians. Public Services and Procurement Canada has delivered on our commitment to ensure the earliest possible delivery of approved vaccine doses. The Public Health Agency of Canada, Major General Fortin, and the Canadian Forces are once again making our nation safer and more secure with their work in ensuring that these vaccines get to all distribution points across the country where they are needed.
Are putting the vaccines exactly where they need to be, into the arms of Canadians. With the delivery and administration of the first COVID-19 vaccines in Canada, this week marks a turning of the tide in this pandemic. But just as tides gradually come in and out, it is too early to declare victory over COVID-19. La livraison du premier vaccin.
The delivery of the first vaccine is a combination of months of work by dedicated individuals in the public and private sectors. The work of those in the scientific community, medical professionals, volunteers, and government agencies. The continued delivery of vaccines will continue thanks to the unrelenting efforts of these same individuals.
Next weeks and months are absolutely crucial in protecting one another and ensuring that Canada emerges from this pandemic in as strong a position as possible. We remain on track to receive delivery of enough doses for all Canadians who wish to be vaccinated by the end of September 2021. While there will be bumps in the road in the weeks and months ahead, we are ready to work through them together, as we have from the beginning of this pandemic. For our part, at Public Services and Procurement Canada, we will continue to be in daily contact with our vaccine developers to monitor production, to push for the earliest possible delivery dates, and to monitor progress with other vaccine suppliers that have not yet received Health Canada approval. My colleagues at Health Canada, the Public Health Agency of Canada, and the Canadian Armed Forces continue to work tirelessly to ensure that safe and effective vaccines are distributed and administered throughout this country. Chaque personne au pays.
Every individual in the country has the responsibility to remain vigilant. We can finally see the light at the end of the tunnel, and we shall do this thanks to our perseverance, our diligence, and our sacrifice.
Together, we will climb this mountain. Thank you. Merci, Miigwech.
Good afternoon and bonjour à toutes et à tous.
Good afternoon, everyone.
488,638 cases of COVID-19 in Canada, including 13,916 deaths. There are 76,310 active cases across the country, and the national average case count is now over 6,650 cases reported daily over the last 7 days. With the ongoing high rates of infection in many areas of the country, the number of people experiencing severe illness continues to increase. Over the past week, there have been, on average, almost 4,000 individuals being treated in Canadian hospitals, including 650 in critical care and 115 deaths reported each day. National data released this week on opioid and stimulant-related harms is a tragic reminder of the broader impact of this pandemic, including the worsening of the ongoing opioid crisis. From April to June, there were 1,628 opioid toxicity deaths in Canada, which is the highest number recorded in a single quarter since national surveillance began in 2016. Now more than ever, we must work together to curb this devastating trend, never forgetting that each and every opioid toxicity death represents a life cut short and a person whose loss is grieved by family, friends, and community. The opioid crisis and substance use more broadly is a highly complex health and social issue. We know, however, that there are interventions that can and do save lives. Prior to the onset of the COVID-19 pandemic, we were seeing early signs that opioid toxicity deaths were declining in parts of the country. Sadly, as the latest data show, we're now seeing a loss in these hard-fought gains as COVID-19 and associated public health measures have impacted the toxic drug supply as well as the accessibility of substance use supports. We can do more to save lives, both during the COVID-19 pandemic and beyond, and must redouble our collective efforts to expand the availability of evidence-based harm reduction services like supervised consumption sites and take-home naloxone programs. and of treatment options, including safer pharmaceutical alternatives to the toxic drug supply. For anyone experiencing issues with substance use, know that there are options available to help. And the Wellness Together Canada online portal is a place to start that includes free of charge supports. By showing compassion towards people who are struggling and knowing what to do if you witness an overdose, every Canadian can help save lives. Visit canada.ca/opioids to learn more. At this time, it is also crucial for us to continue with individual efforts to protect our families, friends, and communities against COVID-19. Stay home if you have symptoms, practice physical distancing, frequent hand washing, wear a face mask in indoor public places, and avoid the 3 C's: crowded places, closed spaces, and close contact situations whenever you can. As we face down these 2 public health crises, it is crucial that we focus on saving every life we can. Thank you.
Good afternoon, everyone. There have been 488,638 cases of COVID-19 in Canada, including 13,916 deaths. There are 76,310 active cases across the country. The national average case count is now over 6,650 cases reported daily over the last 7 days. With ongoing high rates of infection in many areas of the country, the number of people experiencing severe illness continues to increase. Over the past week, there have been, on average, almost 4,000 individuals with COVID-19 being treated in Canadian hospitals, including 650 in critical care and 115 deaths reported each day. National data released this week on opioid and stimulant-related harms is a tragic reminder of the broader impacts of this pandemic, including the worsening of the ongoing overdose crisis. From April to June, there were 1,628 opioid toxicity deaths in Canada, which is the highest number recorded in a single quarter since national surveillance began in 2016. Now, more than ever, we must work together to curb this devastating trend, never forgetting that each and every opioid toxicity death represents a life cut short and a person whose loss is grieved by family, friends, and community. The opioid crisis and substance use, more broadly, is a highly complex health and social issue. We know, however, that there are interventions that can and do save lives. Prior to the onset of the COVID-19 pandemic, we were seeing early signs that opioid toxicity deaths were declining in parts of the country. Sadly, as the latest data show, we are now seeing a loss in these hard-fought gains, as COVID-19 and associated public health measures have impacted the toxic illegal drug supply, as well as the accessibility of substance use supports. We can do more to save lives, both during the COVID-19 pandemic and beyond, and we must redouble our collective efforts to expand the availability of evidence-based harm reduction services like supervised consumption sites and take-home naloxone programs, and of treatment options, including safer pharmaceutical alternatives to the toxic illegal drug supply. For anyone experiencing issues with substance use, know that there are options available to help. And the Wellness Together Canada online portal is a place to start that includes free of charge supports. By showing compassion towards people who are struggling and knowing what to do if you witness an overdose, every Canadian can help save lives. Visit canada.ca/opioids to learn more. At this time, it is also crucial for us to continue with individual efforts to protect our families, friends, and communities against COVID-19. Stay home if you have symptoms, practice physical distancing, and frequent hand washing. Wear a face mask in indoor public places and avoid the 3 Cs: crowded places, closed spaces, and close contact situations whenever you can. As we face down these 2 public health crises, it is crucial that we focus on saving every life we can. Thank you. We have about 25 minutes for questions.
And we'll start with 2 over the phone and come back to the room. So, operator, go ahead with the first question.
Thank you. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour une question. The first question is from, la première question est de Kim Mackrell de Wall Street Journal. Please go ahead. À vous la parole.
Hi, thanks. I'd like to ask about reports that 12 large companies, including Air Canada, Magna, and Suncor, will be rolling out rapid COVID-19 tests to employees of theirs who volunteer to take them. And this would be using antigen tests provided by Health Canada. Can you provide some more information on what the government's role is in this program and when we could expect to see this happen?
I'll start with our procurements on rapid tests, and then I'll ask Dr. Tam to add anything if she wishes. Our procurements of rapid tests are based on the requests and needs of the provinces and territories across the country. As a result of their requests, the Government of Canada has procured up to 40.5 million rapid tests. 9.4 million of those tests have already been delivered to the provinces and territories, with more on the way. Our goal is to ensure that the provinces and territories have what they need to undertake their rapid testing regimes. In addition, we have provided funding to the provinces and territories under the Safe Restart program in the amount of over $4 billion for testing and contact tracing, should they require that and want to utilize that. I will turn it over to Dr. Tam to see if she'd like to add anything more about testing in specific organizations. But from the government standpoint, our priority has been to ensure provinces and territories are reinforced with the testing supplies that they need, both in standardized and rapid tests. Thank you.
Hello, yes, this is Teresa Tam from the Public Health Agency. I think the Government of Canada is working, as you say, with industry partners and laboratories to expand the evidence base. I think the nature of these pilots are there to gather evidence and on the evolving science, and also looking at testing and screening in workplaces or industrial settings. I think there will be more information on that to come. I'm not sort of the lead on this project, but I expect that the leads involved will be providing more information in very short order. But it should not impact on the provincial territorial supplies in terms of the antigen tests. We do have additional tests that are set aside essentially for pilots or for research.
Thanks. And just as a follow-up, my understanding was that the pilot project that we're talking about here was supposed to have been announced today. Testing was supposed to start December 28th. I'm just wondering if you can explain if there was a delay or if something went wrong with bringing it out sooner. And in any event, does it still have a value if a pilot of testing out of testing employees at corporations doesn't come until sometime in the new year or finish perhaps in the spring? Does it still have a value given that vaccinations are now being rolled out?
I think testing forms a critical part of the public health response. And as you've seen, there's pilots, for example, at the international border. So we're trying to gain actual data out of those pilots. So I would see the same for any workplace settings. We have had outbreaks, of course, in workplace settings. And I think these kind of studies will provide more information on what the role of the testing, and particularly if the antigen tests are being used, it will give us more data on their performance. Obviously, to date, much of the test has been done for people who are symptomatic. So some of the questions that we may want to sort of look at is, well, what is the application for screening asymptomatic persons, for example, which we don't have a huge amount of data on using the tests that are available at this point. And so, but I actually, just to be frank, I'm not the lead on the project, so I expect that they will provide the information in due course, but it's never too late. I mean, I think we expect that any industrial setting or workplace to be following the local public health advice, and that all of those measures and the plans for how they conduct their business or work aligns with those. But I do think that testing will become a increasingly important layer of the public health measures, and these studies will provide more information on that.
OK, prochaine question.
Next question.
Merci. The next question is from, la prochaine question est de Micheline Laflamme de Radio-Canada. Please go ahead.
Radio-Canada question. Good afternoon. Since we are talking of workplaces, there are 11 sites in the north of Alberta with outbreaks. And very often in the past, we saw that those outbreaks led to other contaminations in other provinces when workers take the plane to go elsewhere. Are you worried about this, about the consequences this could have in other provinces? Answer, this is Dr. No. Thank you for your question. Yes, we continue having good discussions with our counterparts in the provinces and territories. Every time an outbreak is reported in a province, there's always a committee that analyzes data and also issues like workers and inhabitants of other provinces and territories. So there is good collaboration between public health and all provinces and territories to manage any outbreaks. We are continuing work on outbreaks. Of course, it is a priority for all provinces and territories. Follow-up question, Micheline? Thank you. I would like to know what is being done to authorize the Moderna vaccine. And this may be a two-way question. When will the 200 million doses of the Pfizer vaccine arrive? Because people would like to know when their vaccination clinics will be set up and expanded. Answer. The first question, there were two questions. The one regarding the approval of the Moderna vaccine, it's the same issue. We patiently wait for the Health Canada regulatory process to be concluded. They are expecting more data from the Moderna company. So the decision may come soon, but I don't have any further information for you at this time. Now, regarding your second question, Pfizer doses, what I can say is that Dr. Tam and I are aware of what is going on at every stage, but when it comes to logistical details, it's Major General Danny Fortin who is better placed to give you information. Those are details that are changing. They change from 1 hour to another. So I am not well placed to give you details which I think should be better given to you by Major General Danny Fortin. Maybe Mrs. Annan afterwards, if you have something to add.
Merci beaucoup. Je voudrais dire encore
Thank
une
you.
fois que,
Once again, let me say that 212,000 doses will arrive next week, and in total, 255,000 doses for December, and after that, it will be about 125,000 doses per week in January. And when the doses arrive here in Canada, it's the Public Health Agency of Canada that will distribute the doses to the provinces and territories. That's the methodology that has been adopted. It's very systematic. And as my colleague just said, it's now Major General Danny Fortin who will be working with the provinces and territories to distribute those doses every time. Thank you.
Okay, we'll turn to the room and start with Mackenzie.
Hi, doctors. Mackenzie Gray with CTV News. I'd like to ask about the distribution of vaccines. In the U.S., the former head of the FDA has said that the plan should be that we should not hold back the second dose of the Pfizer vaccine, that since the epidemic is so bad right now, the pandemic is so bad right now, that we should try and vaccinate as many people as we can and hope that the supply chain was able to give us the second dose of the vaccine later on. BC is doing that, but Ontario is holding back vaccines. What is your approach, and what do you think the province here should be doing in terms of distributing vaccines right now?
I think as per the recommendation of the National Advisory Committee on Immunization, people need 2 doses. And there's a minimum interval, and but you know the target is 21 to 28 days in between the 2 doses, and that is our recommendation. Because every jurisdiction has a slightly different set of circumstances in terms of logistics and how well you can predict the arrival of that second dose. All I can say is, for planning purposes, it's great to hear this schedule, because if you know that there's 125K coming every week in January, that makes planning for that second dose much easier in terms of not necessarily have to hold back the initial one. So I think Major General Fortin will have more details, but every day, every hour, practically, these numbers are, there's more precision, I think, to the information. And even the provinces will probably adjust accordingly. So I don't know what they're going to do. Having heard this latest information, they may then decide to do something a bit different with the initial arrivals. But if you're in Newfoundland and you perhaps think there's a winter storm that can hit you, you may do something a bit different than if you were in another jurisdiction. So I think those details are to be worked out on the ground. And your epidemiology is also different.
My follow-up question is for Minister Anand. A board member of Pfizer has said that since the U.S. turned down purchasing vaccines starting in the second quarter, that there is availability to purchase vaccines for other jurisdictions from their Michigan plant starting in April. Is Canada talking with Pfizer about procuring additional vaccines during that time period right now?
Well, hi, Mackenzie. I can't actually see you, but hello. I will say that without question, we are in touch with our suppliers, Pfizer included, almost daily, to accelerate the timelines and to ensure that Canada has the earliest possible access to Pfizer doses wherever produced. It is my goal to ensure that doses of vaccines come into Canada as soon as possible. And certainly I am speaking with the company, as is my team, almost daily to ensure that this is the case. As you can see, our numbers have moved slightly at the margins in terms of increases for our doses in the month of December. Now, as I've said, we're going to be receiving approximately 255,000 doses for the month of December from Pfizer. And that's just an example of how these conversations are ongoing, and we are continuing to push our suppliers.